Now, as temperatures drop in the northern hemisphere and more and more people spend time indoors, health officials fear a rise in COVID-19 cases. And that's not the only concern. Authorities are also worried about the return of the flu season. Now, together, the two diseases could pose a danger to high-risk groups like the elderly.
The global number of new infections and deaths due to COVID-19 has steadied since the end of August. For the past several months, the BA4 and BA5 Omicron subvariants have driven most new cases. But scientists say a number of worrisome new subtypes are also fueling the pandemic. In the U.S., but also other places, they include 3 types that together now account for around 1 in 7 newly reported cases there. In Europe, a lineage detected first in Asia has grown in prominence. In the UK, which has a top-notch surveillance system, experts are tracking the possible rise of still others. And Indian scientists and authorities across the globe are chasing data on a troublesome variant dubbed XBB. In Singapore, estimates show it could now be causing over half of all cases.
And as we come into the winter time now, we are starting to see further increases in SARS-CoV-2 activity. And part of that is being driven, obviously, by these different Omicron variants.
And another infection is compounding concerns, the flu. Earlier in the pandemic, measures that slowed the spread of the coronavirus also helped people avoid getting infected with other pathogens, like those causing the flu.
Influenza, like SARS-CoV-2, is a respiratory infection. So the measures that were put in place to reduce COVID transmission also impacted influenza transmission. So when we reduced our mixing with other people, when we reduced our international travel, that also reduced the ability of influenza to spread.
But as the urgency of the pandemic subsides and measures relax, flu cases are also rising again. Both diseases pose a particular threats to groups like the elderly or people with underlying health conditions, and also to healthcare workers.
Although they may not be at elevated risk of severe disease, if they fall sick, then that also increases absenteeism from work, which has important implications then for the workforce and its ability to the healthcare system to operate. And of course, there's also potential risks that healthcare workers can infect their patients as well.
In an effort to head off the worrisome scenario of a twindemic during the upcoming winter, healthcare authorities from the World Health Organization and other institutions are now spreading a simple message. Timely vaccination against both diseases can save lives.
And to talk more about the possibility of this so-called twindemic, I'm joined now by Richard Peabody. You saw him in that report you just saw. He leads the World Health Organization's high-threat pathogen team in Europe. It's good to have you on the program, Richard, because we really wanted to expand on the idea of what evidence are you seeing that suggests that, can I call it a double blow of COVID-19 and the flu is actually brewing?
Yeah, no, thanks for the opportunity to speak. So we're now coming into the autumn, rapidly into the winter period, and we're certainly, as we just heard, seeing SARS-CoV-2 circulating across the European region. And as people's lives have returned to normal, we're also starting to see the early signs of flu activity pick up across a number of countries in our region. So we are concerned that we may be facing a twindemic, as we might call it, the co-circulation of both SARS-CoV-2 and influenza. And so we're very much encouraging people who are eligible to take up the offer of flu and COVID vaccination and protect themselves and those around them.
And perhaps how could we stave off this twindemic? What could be done at an individual level, and what could governments do?
So, yeah, we can look at this obviously at several levels. On the individual level, if you're in an eligible group, particularly if you're at risk of more severe disease following either infection, so if you're in an older age group, if you've under 65 and have got an underlying risk factor such as heart disease, chronic lung disease, diabetes. All these things put you at higher risk of getting a nasty infection, being hospitalized, and even potentially dying. And vaccination is really the best protection we've got against such severe disease. So that is a really important thing to consider to do to reduce your risk of those severe consequences. There are other things that we can do as well to reduce the risk of these infections spreading. And that relates to these more basic respiratory hygiene measures, such as catching our coughs and colds, avoiding mixing with others when we're unwell with a respiratory infection. And if you're going into a crowded place, particularly places where there are vulnerable others, like care homes or hospitals, then do consider still wearing a mask, because that will reduce the ability of these infections to spread.
All right. We appreciate your time, Richard. Thank you so much for that, talking to us there from the WHO.